Supposed to be used in dentistry or catering. But if you know what they look like, you'll know nitrous oxide canisters are more often found in car parks or fields these days.
Sometimes called fast gas or laughing gas, it's inhaled from balloons for a quick high. Yet it's become a problem not just for nightclubs and youth services, but for the revenue commissioners and the health system too.
Well, here's Conor Wilson on the nationwide impact of nitrous oxide.
Nitrous oxide has been used recreationally for more than 2 centuries. And although it's illegal, recent years have seen a resurgence in the numbers using it, driven in part by social media trends. It's usually inhaled from balloons, filled from canisters that you've probably seen discarded on streets or in parks. Small silver capsules and much larger heavy-duty tanks. They have commercial branding and some even have fruit flavouring. It's easy to buy, especially popular among young people, and it's causing serious health problems for those using it. It's 9 a.m. on a Monday in Finglas South. Ciara Murphy is the project leader at the Finglas Youth Services, where the team sees the effects of nitrous oxide all around them.
Yeah, we certainly hear the young people talking about it, and we would see evidence of it after the weekend outside and around the building. For sure, there'd be canisters strewn around the pathways and in the field behind us. And then the young people would be talking about how it can be purchased on like Instagram sites or WhatsApp messaging, can be bought on the street. It's easily accessible to them and it's affordable. So like if they're at parties, they might not be drinking, but they would say like alcohol's expensive. So this would be their choice of where they get their buzz at the weekend.
And those using it aren't being deterred, even by seeing their friends suffering ill effects.
We've heard of like young people, they'd be out and they'd be like using the gas, and one of their friends might pass out and then they have to call an ambulance. So they're stopping the air getting into their lungs or up to their brain, so they're passing out. Serious consequences. The one serious one was the young girl that we heard that ended up with some paralysis from using it.
What is most troubling is how young some of the users are.
It's as young as 12 that they're doing it. Earlier this year, we heard that a young boy made his confirmation and used some of his confirmation money to go and buy some laughing gas. And when they see other people doing it, because they're posing, like they see it as a status, they have these canisters, they're holding them, they're posing in photographs for them, so younger people are seeing it and they're then jumping on and people are putting up their posts and yeah, you get likes for it, so it must be good. That's, you know, it's just a thing that it's like, yeah, Prime a few years ago, you had a Prime bottle, now we have a gas bottle, which is obviously way more harmful, but it has the same trend, the same effect.
High-profile sports stars like Raheem Sterling and Yves Bissouma have been filmed inhaling nitrous oxide. And social media is awash with nitrous oxide content, with many videos of people using it.
His whole life frozen when he took the smart whip.
There are some accounts selling canisters, including advertisements from the manufacturers themselves.
Bubble up the party, raise your voices, celebrate life, and make most of every moment. Live largely and be bold with Fast Gas.
When Ciara and I take a walk, it doesn't take long to find canisters, probably 30 in the immediate vicinity of the centre. This is a fairly normal find outside the centre, is it?
Yeah, this is what we would see. Yeah, quite often on a Monday morning we'd see this right outside.
While filming, we're stopped by a passer-by. He told us that his relative has just been hospitalised after using nitrous oxide.
It's affecting him in every way. It's affecting him walking, standing. He can't do nothing. He can't eat. He hasn't eaten in a week. And the surgeon is really sick about what could happen or what might happen.
And how do you know that it's down to the nitrous oxide?
The gas, we taking gas.
And you know that?
Yeah, definitely taking the gas. You know, and I just love people to really take on board. If you know anyone, please advise them to stop. It's not worth it. And I just walked by just this minute and I seen this camera and yourself and I seen the bottles and I said, I'm after getting a phone call in a hurry to make me way to Blanchardstown Hospital. He was rushed in this morning again, and we're just hoping we hear good news for him.
Tom's relative is not the only one. Hospital emergency departments and plastic surgeons are regularly dealing with issues caused by nitrous oxide misuse, and many users find themselves with serious neurological problems.
I suppose what nitrous oxide does, at a low level, it is safe or considered relatively safe and can be used in an anaesthetic scenario. However, in excess levels, it blocks B12, and this is really at the heart of the matter. This is an MRI scan. So this dark structure down the middle is the spinal cord, and this all looks healthy and normal. B12 is an essential cofactor for the production of what's called myelin. And myelin is the fatty substance that coats nerves. So if you imagine a nerve as like a copper wire with the plastic coating on the surrounding, if you don't have that plastic coating, the nerve is exposed, will be damaged and can break. This is a person who's been using nitrous oxide, and you can see this bright area, and this was representing the damage or the destruction to the spinal cord because the nitrous oxide has stripped out B12, causing a severe neurological injury.
The patients presenting in Dr. Carney's department can have a range of symptoms.
So it varies. So some people might have lesser injuries, tingling in their hands or their feet. If somebody's severely affected with this, they will have lost the ability to walk. They may not be able to use their hands properly. They may need to be bedbound or use a wheelchair. And this is a young person who was fit and well, healthy, maybe a week before this began. And we've seen cases where people have had prolonged inpatient stays, followed by the need for rehabilitation hospital inpatient stay, which is a significant level of disability.
For Dr. Carney, treating patients as a result of nitrous oxide misuse has become increasingly frequent.
We probably see somewhere between 2 and 3 people per week with neurotoxicity from nitrous oxide. And I suppose, to put that in context, that's not dissimilar to the frequency of neurotoxicity we see from alcohol. But the difference is that alcohol's toxicity is well known, it's well described. There are very strong public health campaigns, and there are limits for alcohol that are within scientific guidelines, but none of that exists for nitrous oxide.
It's difficult to quantify exactly how much nitrous oxide is being used in Ireland. Prevalence data is not collected by the National Drug and Alcohol Survey. But we can tell from the discarded cans alone that there's plenty in circulation. It's not easy to smuggle canisters into nightclubs, so they're being used outside, leaving nightclubs to clean up the mess outside their premises at significant expense. Visits we made to the car parks of a number of nightclubs showed no shortage of canisters and evidence of recent usage. In Ireland and elsewhere, car parks appear to be a hotspot for nitrous oxide use, leading to concerns about its impact on driving. Right across Europe, huge numbers of road crashes have been attributed to nitrous oxide use, many of them fatal.
Cameron Hughes doing laughing gas while driving on the A56 earlier this year. Soon after this, he lost control of his van and crashed into a ravine, killing 15-year-old Bonnie Barrow, who was also in the car with him.
In Ireland too, it has been mentioned as a factor in at least one road death.
Dylan was a happy-go-lucky young man, He was the comedian of the family, He always came in and made us laugh and smile, and, he was just a great lad all round. He had looked after my mother. My father died a year and a half before Dylan, and he took on a role most young men wouldn't take on. He stayed with his grandmother on weekdays, and, we'd get up in the morning, make sure she was okay in her bed, and she got up okay, and she got to bed at night time. My mum had somebody there every night to stay with her.
For Catherine and her family, everything changed on a November night 2 years ago. Dylan had gone for a night out in the Buzz nightclub at the Red Cow roundabout.
Well, I was in bed. It was around 12:40, early Sunday morning, and got a phone call from my stepson, and he was hysterical on the phone, and all I heard him saying was, Dylan is dead, Dylan is dead. And it was like, I was woken up out of my sleep, and you know, it was just a total shock. I said, you know, calm down. I said, say that again. I said, calm down. I said, he said, Catherine, he said, Dylan is dead. He's had to been in a car crash. And I just, you know, my whole body just shook.
The car in which Dylan was travelling to the club had pulled in on the side of the road outside. Dylan was getting his jacket from the boot when he was struck by a car travelling at twice the speed limit. Catherine and Dylan's father both went to the scene as soon as possible.
Dylan was on the ground, a white sheet up to his chest and blood pouring from his head. You know, we had to stand back so many feet from Dylan, we could only get so close to him. And when I seen it was a you know, he was lying on the ground as if he was just asleep. There was blood pouring from his head. And I said to the guard, I said, can I hold his hand? Can I give him a kiss? I want to kiss my son. I want to hold my son. I said, you know, I want to hold him. And the guards looked at the forensics, and forensics said, just shook their head and he said no.
The driver of the car that struck Dylan was Cameron Cooper. Though it's impossible to say now whether he had ingested any, balloons and empty canisters of nitrous oxide were found in the front of the car, the judge noting that Cooper and his passengers had obviously been having a good time. Cooper was convicted of dangerous driving causing death and sentenced to 4 years in prison in March of this year. He'd been driving without a full licence and with no insurance. He didn't stop after hitting Dylan. He falsely reported his car as stolen to the Gardaí before handing himself in 3 hours later.
His warmth and generosity left a lasting impact on everyone who knew him. We don't cope. We don't cope. Me, myself, I don't live anymore. I only exist, and I only exist for my children and my grandchildren. Everything is different. Everything has changed. I'm not the same mother. I'm not the same daughter. I'm not the same grandmother. I'm not the same friend. I'm not the same sister. I'm not the same person. I have morphed into this person that I do not like. I'm a very angry person where I wasn't.
It's difficult to gather accurate data on road crashes caused by nitrous oxide use in Ireland. In a statement to Primetime, An Garda Síochána said that it is illegal to drive a vehicle under the influence of an intoxicant or exceeding alcohol limits. Gardaí can use a preliminary roadside test to detect alcohol levels and a list of illegal drugs. These are provided by the Medical Bureau of Road Safety, which is also responsible for testing provided blood and urine samples. The statement also said that the Medical Bureau of Road Safety does not currently test for the presence of nitrous oxide.
You can buy on the street, you can buy anywhere. You know, you can go online yourself and buy if you want. They're selling to the young people, the young crowd, you know, and they don't realise the dangers of it. You know, just people being left paralysed. And my son is a victim of it. You know, in my eyes, he's a victim of it, of the fast gas, in my eyes. You know, and this is what we're left with, the heartbreak, we're left with the grief, and we're only left with memories of my son, all because of this fast gas.
Nitrous oxide is not currently a controlled substance under the Misuse of Drugs Act. It does have legitimate uses in medicine and in catering, and it's entirely legal to buy and sell it for those legitimate uses, so long as it's not for human consumption. But it is still easily available online, and we were able to order this box of 50 cream charges and have it delivered the very next day. But it's all nitrous oxide. The gas in this is exactly the same as the gas in this. Many people buy their nitrous oxide from drug dealers, the very same way they would with any other drugs. It's now a hugely lucrative illegal industry, with vast quantities being brought into the country.
What we've seen in the last 2 years is an increase, because there is money to be made here. So in the last 2 years, we've seized about 100,000 canisters. Majority coming through Dublin Port and Rosslare. And they're coming through pallet loads in containers and then coming through to the ports and then being distributed throughout the country. And we're talking 97, 98% of it is coming through the ports. So it's organised crime. So it's organised crime gangs who are making money on the back of society.
Ireland's ports handle 51 million tonnes of freight a year. A sophisticated operation is needed to intercept illicit goods. This X-ray scan shows a truck with 5,000 canisters of nitrous oxide hidden on board, with an estimated street value of €185,000. The customs operation is very much focused on finding the newer large canisters.
As the years are going on, we're seeing more and more of the larger canisters. What we have been told is there's no legitimate use for that 1.5 and 2.5 kilos, so those larger canisters, and that's what we're seizing. We work with our partners in Organised and other agencies. We work internationally with colleagues as well. So it's very much intelligence driven. And then after that, from a technology point of view, crunching data. It is data analytics, it is risk profiling. We don't just simply pick a pallet or pick a container for scanning, because there's so many containers coming through every single day, and we are successful.
Even with customs seizing 1,000 canisters a week, enough is getting through to create huge problems in Irish life. The question now is what can be done next.
I am really sick. I'm very worried about it because there's too much going on. There's too much going on with all this everywhere, and you just love people to stop.
I know from speaking with colleagues, and we have published results of the extent of damage and harm that nitrous oxide does. This is a nationwide problem. It's certainly not exclusive to one site or one centre.
Something needs to be done. Like we change, we jump drugs, like you see new trends coming in, and we need to be at the forefront to try and be stopping them when they start, like to be cutting them out quicker than what we are.
That's Conor Wilson reporting there. Well, if you've been affected by any of the issues raised in Conor's report, help is available. Just go to rte.ie/helplines. With us now is Minister of State for Public Health, Wellbeing and the National Drug Strategy, Jennifer Murnane O'Connor, and Mark Ward of Sinn Féin. Good evening to you both. Might start with you, Minister. We saw revenue there say to Conor, 98% of these canisters are coming through the ports. Organised crime gangs are involved. What has your government done to address that?
Well, first of all, I want to give my sympathy to Catherine on the death of her son. It's just, it's a very sad case, and for anyone that has lost a life through this, so, sympathies. And I can say, as you know, this is within the remit of Minister Jim O'Callaghan, working with myself. Good work has been done. As you said, over 5 million worth of these canisters have been seized in the last 2 years. We need to do more. But the issue is, this seems to be an emerging trend that has come again, that has recently now is growing. Absolutely.
It's been emerging for some time, Minister, notwithstanding the seizures of revenue. We saw it there in Conor's report. Boxes and boxes of them piled up at nightclubs. When I'm driving around this city, I can see them everywhere. There is an absolute proliferation of them everywhere. And what I'm asking is, what is it your government has specifically done to address that?
OK, first of all, we have to remember, this is regulated under 2 acts. So first of all, it is illegal to sell these canisters to under 18. It is illegal for human consumption. So anybody that is selling them is breaking the law. So there is regulation there. And I think it's important for anyone that has a concern or that is worried that they need to know that we have information and awareness online under drugs.ie, under my own remit of health and wellbeing, which is my remit. I put 1.5 million for the next 3 years into education, awareness.
Can you honestly say, Minister, that your government is on top of this problem?
Absolutely, we need to do more. There is no question about that. We need to do more. We see the challenges there, and when we see that chap there, it's frightening. No, I am saying that we as a government, we need to do more. We work together. There's all the different departments working together. So that's what we need to do, but we need to do more.
Mark Ward, is the government on top of it, and have they done enough?
So first of all, I just want to commend Prime Time for an excellent piece of journalism. I've been banging this drum since 2020 at this stage, during COVID, when I first noticed the silver bullets canisters lying around my area. And I've been raising this, I think I just checked before I came in, 16 times in the Dáil in the last 4 years I've raised this issue. And nothing, in my opinion, has happened to stop it. As you see, it's only increasing. So at the moment, the government aren't doing enough. They need to do more. I have legislation that is ready to go. It's past first stage. And it's very similar to legislation. This is not just in Ireland, this is right across Europe. There's other jurisdictions that have brought in legislation, and it's very similar to what was brought into other jurisdictions. But basically what it will do is the seller will have to have a licence to be able to sell it, and it can only sell it to an approved list of purchasers. And then approved list of purchasers would be people that have legitimate purposes, reasons to use it, people like in the catering trade, in the medical trade, and people like that.
Why not just propose an all-out ban?
because it has legitimate purposes. So it is used in dentistry, and it is used in catering industry, it's used in veterinary industries as well. So it has got legitimate purposes. It's very difficult to ban it. The legislation that I have went through the OPLA, which is the Parliamentary Legal Affairs Division in the Oireachtas. It took about a year and a half, and I know we simplified it then, but it took about a year and a half to get to the stage where it is now, so it's robust enough to go through.
That's the bill there, Minister.
Yeah.
Would your government be willing to support Mark's bill?
Well, we're absolutely looking at everything, and as you know, at the moment...
But would you support his bill?
Well, at the moment, we are also looking, the EU are also looking at regulating, and we work within our own remit with the EU as well. We will absolutely, as a government, look at the bill, but we will, and as Mark has said, like, there is a need for this. If you look at maternity hospitals, labour wards, dentists, catering, the motor vehicle, there is a lot of good use here. So what we have to do is we have to really curtail.
But you're saying you have to, Minister, and you're saying the government needs to do it.
We
saw in Connor's report, governments across Europe have taken steps to deal with this.
And we're looking at
Why
this.
have you not done it?
But
Mark's been raising it since 2020.
Yeah, well, I can say that we are looking at this at the moment. When you see the trends, look, what's happening at the moment, everything is changing.
There are children losing the use of their limbs because of excessive use of this substance, and nothing has been done sufficiently to clamp down on it.
No, we are. Look, as I said, there has been regulations there. It is, what's happening is unacceptable, but we are, and as I said, I spoke to Minister Jim O'Callaghan today about this, that we are working on this. We do see we need to do more, absolutely. One life lost is too many, but we do need to do more. We need to look at this bill. We need to look at our counterparts in the EU to see what is happening, and we are looking at
Just to think of Catherine there talking about her son Dylan, it's absolutely heartbreaking. And one of the things that Connor covered in his report is that the Medical Bureau of Road Safety doesn't test for it. The guards can't test to see if somebody is under the influence of nitrous oxide. Does that need to change?
Oh, we need to look at that too. There's no question about it. Again, that would be for the Department of Justice, but we absolutely need to do that. Yeah, there's no question about it.
Mark?
Yeah.
Absolutely, there's a hell of a lot that we need to look at.
We need to do more.
Absolutely, Minister, and I agree. We need to do more. Like, for example, which wasn't said in the report, in the last year there's been a 175% increase in the amount of young people who are presenting to the adolescent addiction services, and these are just young people who have been identified that there's a problem with nitrous oxide. I expect that's only the tip of the iceberg, because as you said yourself, you walk around any house in the state and you will see discarded nitrous oxide canisters there. The Minister's right. The EU are going to bring in a law in 2027, the 1st of February is when they're trying to harmonise across Europe. But why wait? Why wait in Europe? We have a crisis here today in Ireland, and we need to do so. Minister, I'd give you an early Christmas present. I've legislation there. You can have that, and you can introduce that yourself, and any amendments that you want to introduce to it, I will work with you on it, because something needs to happen now.
Well, as I said, as a government, we will look at this. It will be the government working with myself that we will address this, and working with Mark. And I want to compliment Mark on the work that he is doing too.
Is there any particular reason, Minister, why there hasn't been a public campaign around this? Because we see public campaigns and public health issues across the board. Why has there been no campaign?
Well, I can assure you now, within my own remit of health and wellbeing now, there will be awareness. There is funding there, 1.5 million. Oh, now, I have, at the moment, we are putting a programme together. We will be working on addressing awareness. Education is absolutely vital here, and that's what we want to do. Look, we all want to work together. We don't want to see this happening again, and it's something that we, as a government, are committed to, working with everybody, because it's all of us working together.
I want to ask you, Minister, about something, a different story this evening. Primetime published a story online about the National Transgender Service. They have announced that they're going to close their waiting list as a result of a lack of resources. They say a chronic lack of resourcing is now at a critical point. And Miriam will be speaking in a moment with Dr. Paul Moran from the service. But what would you say to transgender adults tonight hearing this news, that because of a lack of resourcing, the waiting list is to be closed?
Yeah, no, this needs to be looked at, and the department received this information this afternoon. They will look at the full implications of this, and I would say this is a very important issue that we need to look at. But as I said, this only came into the department this evening, and they will look at it.
Let's look at one issue connected to it. Why is there such a lack of resources for transgender healthcare?
Yeah, well, definitely we'll have to look at that. And as I said, this only came to light to me this evening before I came in, so I will certainly talk to the Minister.
There have been warnings, Minister, for some time now about this service being run out of a porta-cabin.
Yeah. Well, we need to address it, and we need to look at the full implications of what will happen, absolutely. And we don't want, I suppose it's more important now that we get the information out there and the certainty and the clarity of what is going to happen.
Mark's colleague, David Cullinan in Sinn Féin, has said the current system is on the point of collapse. Is he right?
I hope not, but look, we need to address it. As I said, it has come to the department tonight. We need to address this as urgently, and I can assure you I will be going back to Minister Jennifer Carroll McNeill first thing in the morning about this to work on it straight away.
Minister Jennifer Marlene O'Connor and Mark Ward of Sinn Féin, thank you both for speaking to us tonight.